Good morning, Mrs. R. I'm Hannah, a nursing student. I'm helping the nurse to take care of you for today, yeah? Okay. I saw you sitting here quietly, and I was wondering, would you like some company?
Yes, nurse, I'd love that.
Okay, that's good. Mrs. R, how have your days been lately?
Not much. I'm just sick, and sometimes I look at my family's photos.
I hear you. It sounds like your days feel a bit slower, yeah? But do you still find any moments or even just a little moment that you find satisfying or enjoyable?
No, I don't feel like doing much more.
Okay. What about the things that you used to do before? Do you still find it interesting?
Not really, especially when I can do something like before.
Okay. So even the usual activities don't feel the same anymore, yeah? Okay, that must be really hard for you. Do you ever get a sense for the day that the day feels a bit empty?
Yes,
Mm-hmm.
I feel like I'm not doing much anymore.
Okay, I'm really sorry if you feel that way. When you're here during the day, what usually fills your time?
I feel more sad than happy.
I'm really sorry if it feels that way. When you're here during the day, what usually fills your time?
Not much. I'm just sit and then sometimes lie down, look at the photo, and I just get bored.
I hear you. It sounds like your days been a bit long, yeah, and a bit meaningless. When the boredom comes, what do you usually feel?
I feel more sad than happy, I think.
I'm really sorry if you feel that way. Sometimes when people feel like that, it affects their memory and also their focus. But for you, Mrs. R, do you feel a big changes in your memory?
No, I think I can still remember things okay.
Oh, that's very good, Mrs. R. Do you still feel that your life is meaningful or worth living?
Yes, I believe that even sometimes it's hard for me.
Okay, I'm really glad that you feel that way. Though I can hear that you have a bad day sometimes, yeah. Do you ever feel like you're not as useful or valuable as before?
Yes, because especially when I can do something like before.
Okay. When you think about your situation, does it feel hopeful or more difficult and uncertain?
Sometimes it's difficult because I think there's nothing that would change in my life.
Oh, okay, Mrs. R. When you look at people around you, do you feel that they are better off than you?
No, I try to think not like that.
That's wonderful, Mrs. R. Thank you for sharing that with me. Now, I can a bit understand about your feeling.
Okay. Kara, are you already finished?
Yes.
Okay, thank you, Kara. So, hello, Mrs. R. How are you today?
I'm okay, but just a bit tired.
Good morning, Mrs. R. We're just going to check on you. Did you assess her GDS?
Yes, Dr. Ida.
And what did you find?
Okay. So Mrs. R has been feeling low in mood and energy, and sometimes feel less useful than before. Yeah? she still finds meaning in her life, and also her memory is intact, and she is able to engage in some activities. And based on my assessment, her GDS score is 10. It suggests moderate depressive symptoms. Yes.
Okay, thank you, Clara. Mrs. R, thank you for sharing your feeling with us. We will work together to make you feel better.
And later, after this, the nursing student will accompany with you. She is Astapin, okay? Please, she will accompany with you, okay? Astapin, excuse me,
Good morning, Mrs. Ed. I'm Estafin. How are you feeling after your rest? Still feeling a bit weak?
Yes, nurse. My body is still very weak and tired.
Okay, I understand, ma'am. So I'm here. I will talk with you for about 10 minutes. It's to check your safety while moving, and then we want to make sure that you are not falling down. Is it okay for you?
Yes, nurse. That's okay.
Okay. So, ma'am, I want to ask you some questions. First, in the last 3 months, have you ever slipped or falling down?
Yes, about 1 month ago in the bathroom, the floor is slippery and I feel very weak and very dizzy when I stood up, and yeah, I fell.
Okay, I'm sorry to hear that, yes ma'am. It must have been scary. I will take a note in your medical record, yes. And the second, I checked in your medical record. It says besides asthma, you also have a high blood pressure, right?
Yes, nurse, that's right. When I have trouble in breathing, my body is very weak and easily to get tired, and my body is more heavy than before and usual.
Okay, I understand, ma'am. When you're breathing and your blood pressure is stable, it means like your body need to oxygen or less of oxygen, so you feel very weak. Okay, the next question is, when you walk around, do you usually use walking aid like a cane?
Yes, I always use a wooden cane because if I don't use it, my legs is very weak and it cannot support my body.
Okay, that's very good, yes ma'am. You always use your cane and it's help you to stay balanced, yes? Okay, I wanna check your hand. You have no IVs. Okay, so it means like you can move freely, yes, without it to touch in your hand. Okay, next question is, can you try to sit up straight and you can move slowly?
I cannot nurse. I feel very weak, especially in the morning. My body is unsteady.
Okay, it's okay. You don't need to force yourself, and I will help you to take a pillow to your body can lean comfortable. Okay, for the last question, do you feel safe working by yourself, or do you wait to nurse to come here to help you?
Sometimes I feel I can do it by myself, but and then I forget that I'm not strong as usual, and sometimes I lose my balance also.
Okay, I appreciate your spirit, yes ma'am. But for now, your safety is the most important thing, and please don't hesitate to call us, yes ma'am. Okay ma'am, I already done with my assessment, so I want to report the result to the senior nurse and doctor. Excuse me.
Yes, nurse, thank you.
Again, nurse, I want to report the result for the Mrs. Air. The result is her Morse scale score is a 80, and which is the high risk. And she has a history of falling last month, and then currently uses the cane and has a weak gait. Additionally, she often forget her physical limitation and tries to move independently. And we have implemented 2 precaution fall. And do you have any further orders to improve her stability?
Okay, keep an eye close on her, and then I suggest to maintain the bed will still close, and then bed rail stay up. And thank you for the result of assessment. I will inform the doctor.
Okay, nurse.
May I get it?
Yes.
Okay, thank you.
Okay, nurse.